Happy day one and all. I am Dr. Aparna, Fertility Consultant, GarbhaGudi IVF Center. Today's our topic of discussion is what are all the common causes for male factor infertility. Nowadays, in the recent decades, we are seeing there is a very high increase in male factor causes for infertility. Almost there is an increase up to 40 to 50% the infertility causes due to male factor. How we will address the male factor infertility? When a male partner comes and gives the semen analysis, we usually analyze how is the volume of the semen, how is the concentration of the sperms in that, and the motility of the sperms and the morphology of the sperms. All are equally important to assess the male factor fertility. And semen analysis is the most common test what we do to assess for the male factor infertility. Volume should be minimum 1.4 ml. The concentration of the sperms should be at least 16 million per ml. In that, the progressive motile sperm should be at least 30% and the total motility should be at least 42%. Morphology of the sperm, that is the shape of the sperm, where we assess the head, neck, body and the tail. All the parts of the sperm should be normal to call it as a normal sperms, which should be at least 4%. Also, we assess is there any infections in the semen also. Now coming to the common causes of the male factor infertility. Recently we are seeing the lifestyle factors affect on fertility like obesity, higher weight and the lifestyle habits, that is the smoking, alcohol intake or any form of substance abuse. Our work style, stressful life, everything can affect our semen parameters. Next, coming to our occupation. Is there any chemical exposure in our occupation? Are we working in a very high temperature or very high climatic conditions? All these affects the sperm production. Then the other common cause is varicocele. What is varicocele? There will be a dilatation of the vessels which supplies the venous or the blood supply to the testes. If there is any stagnation of the blood vessels, it can result in high temperature, resulting in decreasing sperm parameters or sperm production. Or also it can be due to any previous surgeries, the medical history like diabetes, hypertension or any thyroid dysfunction or prolactin dysfunction also can result in semen abnormality. Any surgeries, as I told before, related to any hernia surgeries or hydrocele surgeries or any abdominal surgeries can result in abnormal semen parameters. If there is any history of cancer, which can also decrease our fertility. So all these are the most common causes of male factor infertility. Also, we should take the family history or the childhood history. Childhood history especially, is there any infections or any injuries to the private organ in childhood which can result in a decreased sperm parameters. If there is a family history of male factor infertility, which can also be transmittable to the offsprings. So all these are the important causes. If there is any of these concerns addressed, kindly please approach a fertility specialist for the proper evaluation and the treatment. Thank you.